Good day, everyone. This is Edgar Sevilla, BSID Math 1. So today is another day and another topic that we are going to tackle. And guess what? Our topic for today is all about multiple disability. So, when you hear a word multiple disabilities, what comes up in your mind? Okay. Multiple disability is all about a person is having two or more disabilities. So today I'm going to discuss what are the causes of multiple disabilities and what are the teaching strategies to a student or a pupil having a multiple disabilities. So as a teacher, it is very important to know how to handle a student or our student having a multiple disabilities. What are the causes of multiple disabilities? So first, we have here chromosomal abnormalities or chromosomal disabilities. So, many types of chromosomal abnormalities exist, but they can be categorized as either numerical or structural. So, when you say numerical abnormalities, are whole chromosomes either missing from or extra to the normal pair, while structural abnormalities are when part of an individual chromosome is missing, extra, switched to another chromosomes, or torn upside down. Chromosomal abnormalities can occur as an accident when the egg or the sperm is formed or during the early developmental stage of the fetus. The age of the mother and certain environmental factors may play a role in occurrence of genetic errors also. Chromosomal abnormalities can have many different effects depending on the specific abnormalities. Let's have, for example, an extra copy of chromosome 21st or 21 pair causes Down syndrome or what we call trisomy 21. Chromosomal abnormalities can also cause miscarriage, disease, or problem in growth or development, which is causes also to multiple disabilities. Another causes of multiple disabilities is premature birth. So premature birth can lead to long-term intellectual and developmental disabilities for babies. These are problems with how the brain works, and they can cause a person to have trouble or delayed in physical development, learning, communicating, taking care of himself or herself, or getting along with others. Some long-term conditions linked to premature birth include cerebral palsy, also called as CP. This is a group of conditions that affects the part of your brain, the brain that control your muscles. This can cause problem with movement, posture, example standing up straight or balance. Next is behavior problems. Some students show that premature babies may be more likely to have attention deficit hyperactivity disorder, also called as ADHD, that babies born on time. ADHD is a condition that makes it hard for a person to pay attention, control, or to control his or her behavior. Next is mental health conditions. Premature babies may be more likely to have anxiety or depression later in life. Depression is the medical condition in which strong feelings of sadness last for a long time and interfere with your daily life. So it needs treatment to get better. Anxiety is when you feel worried or fearful. To these feelings affects your daily life like school works, jobs, or relationships with others. Another is neurological disorders. So these conditions affects the brain, spinal cords, and nerves throughout the body, and that's the reason why premature birth is one of the causes of multiple disabilities. Another causes of multiple disabilities is difficulties after birth. Some disabilities develop after birth. This includes hearing problems, heart conditions, and blood, metabolisms, and hormone disorders. Detecting these problems soon after birth can prevent them from becoming more serious physical, intellectual, visual, or hearing disabilities, which is characteristics, or it can be the causes also of having a multiple disabilities. Another causes of multiple disabilities is poor development of the brain or spinal cord. Many children with brain and spinal cord defects also have visible abnormalities in the head or back. So symptoms of the brain or spinal cord damage may develop if the brain affects the brain or spinal cord tissue. Brain damage can be fatal or result in mild or severe disabilities, which may include intellectual disabilities, seizures, and paralysis. So, spinal cord damage can result in paralysis, incontinence, and loss of sensation to areas of the body reached by nerves below the level of the defect. So, that's the reason why poor development of the brain or spinal cord can be a reason of multiple disabilities. Another causes of multiple disabilities is infections. Infections also contribute to a disability during early childhood. For example, one of the common causes of hearing impairment in developing countries is due to a chronic suppurative otitis media or CSOM. So there are many types of infections that can lead into disability. And all of these are potential preventable by vaccines. However, systematic studies to identify each infection's cause and their contributions to a total disease, economic and other burdens in disability are lacking. So that's the reason why infections also the reason of multiple disabilities. Another cause of multiple disabilities is genetic disorders. Genetic disorders occurs when a mutation or a harmful change to a gene, also known as a pathogenic variant, affects your genes, or when you have a wrong amount of genetic materials. So genes are made of DNA. So what do you call, or what's the meaning of DNA? So that is deoxyribonucleic acid, which contains instructions for cell functioning and the characteristics that makes you unique. You receive half your genes from each biological parents or your biological parents and may inherit a gene mutation from one parent or both. So some genes change due to issues with the DNA mutations. This can raise your risk of having a genetic disorder. Some causes syndromes at birth, while others develop over time. So, those are some of the causes of multiple disabilities. So, we know already what are the causes of multiple disabilities. So, now we are going to discuss what are the teaching strategies to the students having a multiple disabilities. So students with multiple disabilities required unique instructions, adaptations, and modifications to their entire learning environment. So it is very important for these students to participate in a functional curriculum that focuses on the skills the students will need to be independent as possible and as active and engaged as possible. So what are the teaching strategies for the students having a multiple disabilities? So we have here first, use short, simple sentence. So for that, the students will easily understand what you're trying to say, or dali ra silang makasabot kung unsa man ang buot nimong isulti or buot nimong ipaabot nila. So next is call students by name before asking questions. So this is the way also for getting their attention by calling their name. So importante sad na sila nga before nimo sila pangutanon is imo sa nilang or imo sang kanang tawgon ang ilang ngalan para mag-get nimo ang ilang attentions. Next is repeat instructions frequently. So, as students having multiple disabilities, dugay gina silang maka-absorb og mga instructions. Dugay silang makasabot. So, if feel nimo og na-obserbahan ba nimo nga wala nila ma-absorb, then repeat, repeat, repeat the instructions until ma-absorb nila. So next is keep distractions changes to a minimum for better attention. So mugawas na ni ang atong pagkakuan ani pagka-investigador kung unsa ang mga nakahatag or dali nilang makakatch og attention. So as a teacher dapat ana ra gyud nimo permi ang ilang attention. So mangita na kag pamaagi ana kung unsaon pag-catch ang ilang attention. Next is teach specific skills with breakdown of small steps. So, imo siyang tudluan og mga skills kanang ma-independent siya but in small steps or in a gradual way or hinay-hinay in order nga ma-absorb niya or makat-on jud siya. Kay lisod man gyud ni sila nga tudluan. That's why hinay-hinay ang pagtudluan nila. So next is provide an encouraging, supportive learning environment. So usa ni sa pinaka-important encouraging or encouragement, di ba? Bisan kita man gani need magitag encouragement to sa hay, di ba? So samot na sila nga disabled sila. So next is simple conversations for inclusion with peers. Of course, dapat salti-saltian po na sila. Mga simple conversation, kumusta naman ka, ana, kanang murang makakuan ka nga naa sila connections or dili sila maka-feel nga sila ra ingani sila alone sila. So muna siya importante conversation with peers, di ba? And last is patience. Of course, when you teaching students having a multiple disabilities or any disabilities, ma-test gid ang imong patience. Of course, because dili lalim ni sila tudluan. So nara gyud nimo ug asa gid kutob ang imong pasensya nga magtudlo nila. So those are some of the teaching strategies to a students having a multiple disabilities. So I hope that you've learned something from my discussion from our topic for today. And thank you so much for watching. God bless. Bye-bye.